One of the most popular questions that I get all the time: do you have to have a physician over you to start your own business? Let me explain all the things. So, I am Tiffany. I own a mobile IV therapy business, and I currently also teach nurses how to start their own. Yes, you have to have a physician over you. If not, you are operating out of your scope of practice by essentially ordering the infusions. I will tell you, a lot of places do not do this correctly. A lot of places will have a medical director and they never see the patients, which is a big red flag. I teach in my class the correct ways to do this. Every state, of course, has different laws. I lay out the different structures of the different options that you can do, and then the type of lawyer that you want to go to. You 10 out of 10, you are doing yourself a huge disservice if you are not getting a lawyer. You want to know that you're setting everything up correctly. Yes, I know it costs a lot of money. I am very aware. I have done it. But it will keep you safe and it will keep your practice safe. And it really gives you a lot of peace of mind that you're doing everything right and something's not going to come up to you one day and your license is going to be in jeopardy. So, yes, 10 out of 10 do this. In my course, I go over the specific type of lawyer that you want to use and the questions that you want to present to them, because if you do not find the right lawyer, then you are going to essentially be paying, although it might be cheaper, if they are not knowledgeable in these two areas, then they might know one very well and not the other. And if they do not know the other, this means they're going to be doing a lot more research in this area, which they are going to charge you a lot of money to do the research in this area. So that is why I essentially have done the research and gone through the legal process. So I lay out the different structures. That way, when you first talk to the lawyer, and I teach you what interview questions you should ask them, because you should not just go with the first lawyer that you find, because you can get burned, and if you do not do your research on this, it can cost you thousands of dollars. So we really go over the different structures, what type of lawyer you should use, and that way when you're talking to them in the beginning, you can kind of tell them, and they really do appreciate when they know that you're educated in this too, because it makes the back and forth so much easier, and they kind of realize, okay, they're either going to be familiar in it already. They are going to have to do some research, because there isn't really a lawyer that is just like, okay, all I do is help mobile IV therapy businesses start up. Typically, they're helping a lot of different types of medical businesses, and so they're going to have to refresh themselves. But whenever you're able to give them these different layouts, it really cuts down on the time. Yes, you must have a provider, depending on your state and certain laws. Some nurses are able to work with the medical director who is doing that primary consult. You have to establish the patient-physician relationship. You have to do that. I know it does not happen, and I know it's really frustrating when you are paying all this money to do it the right way, and Joe Schmo over here is not doing it that way. But trust me, it will save your license. It will build trust with your patient. I cannot tell you how many times I've had patients tell me, I feel so much better because I talked to a physician. How we do it, we are a state that is more structured. So we have more rules because of certain laws that are in place. But how we do it is we get people's past medical history. And of course, there's certain things that we look for, kind of a screening process. If I ever have somebody that will just book an infusion, I always, always, always reach out to them and ask more details. Think about if you're coming into the hospital, you don't have somebody that's just like, I want this. Pause. You do have people that do that, but as a nurse, what they say is not always what they need. So it's kind of like triaging. You have to go through and ask them questions and ask certain life factors that are going on and why they want this. And there's a whole process that you go through. And I teach this as well. Once you do that, then we double check with our medical director to be like, hey, what do you recommend for them? A lot of times you will become familiar with it, and so you're able to educate on it, and then the physician can kind of say, like, yes, that is right. I would recommend that, or I would change this. After they filled all that out, then whenever we go to their appointment, mind you, we've already have their past medical history. At that point, we've already kind of discussed what we're going to do at the infusion. It is already laid out. We get to the infusion, whether this is the next day or just at some point when they're on the schedule. We will do a telehealth consult with our physician. So he's establishing that patient physician relationship. He's going over, the risks, the benefits, what you're getting, how it works. I'm telling you, your patients love this. It is not done very much, but they love this. It makes them feel so much more confident in what they're getting, because especially if you're in a city where infusions are not popular, like Oklahoma, then sometimes these patients are like kind of sketched out. You can just tell they're like, I kind of feel like I shouldn't be doing this in my house because I'm not in the hospital. So it really is reassuring to them. And then also, as a nurse, you're going to be knowledgeable in it and educate on the process as well. But the physician is educating on all of that, answering questions, risk and benefits. And then after that, we get a set of vital signs, and then we do the infusion. And then, of course, if there's any random vital sign that's off, for example, if they're a sick infusion and they're dehydrated and their blood pressure is a little bit on like the lower end, and it's kind of your discretion, or if your physician has a certain number that's like, hey, if it's below this, please recheck. That way it's showing you did something, there was a problem, and you intervened. So we recheck things that are off. So for a lot of times, those patients, for me, I just recheck a blood pressure, and then I'll recheck a heart rate, because a lot of times they'll be like slightly tachycardic, and it just kind of gives the whole picture in your charting that the fluids helped, their blood pressure has gone a little, like their blood pressure's improved, and their heart rate has, gone down because they're not as dehydrated anymore. So that's how one of our infusion processes go. We have a little bit more extensive with certain infusions that have a little bit more to them, but most places do not do this. And because of certain laws that are in Oklahoma, which I go over on our course for you to be mindful and ask your lawyer, because if we did not have said rules, then we would be able to operate off protocols, where this means he sees the patient the first time, and then he could set like, okay, you need to be reassessed or do another patient interview or consult every 3 months or every 6 months. But because of the specific laws in Oklahoma, which unfortunately I think they are in a lot of states, but a lot of people are not familiar with them, then we are not able to do that, and we have to have each encounter has to have its own consult. And people think this is a big process, but it's really not, because think about it, the patients that you're seeing are very low acuity. They're 4s, maybe like probably 5s. They're very low acuity. They're just, if they're here for wellness, then they're definitely a 5. They're being proactive about their health versus reactive. If they're sick and they're vomiting, then they need a little bit more done. But these are not patients that require a whole extensive, like you think about in the hospital when they are doing a consult with, infectious disease or something. It's not a huge, big process. And I think especially coming from the hospital, and a lot of nurses start this business from working in the hospital, you think about how in depth everything is in the hospital, and then think that's what it has to be carried over here. And actually, infusions actually fall under the med spa practices, which are a lot more laxed, but not to say you should do things more lax, because we have talked to the board of osteopathic medicine, and they said, yes, they're just waiting on a time to crack down on it. So yes, even though it's under the med spa rules, they told us that they would, if something happened, we would be held to the liability as if we were a medical clinic. So because of that, that's why you really want to make sure that you have your legalities in wrapped up in a little package with a bow to protect your license, but also to protect your patients. Nothing that I am giving is legal advice. I am not a lawyer. I am just giving recommendations and different structures of how you can outline your stuff. And then it's kind of the research is done for you, and then you have a lawyer, a specific type of lawyer, confirm this for you. That way you can be set in your practice and that be one less stress that you have to think about when you go to bed at night, because legalities is probably one of the biggest things. So I'm Nurse Tiffy. I educate on all things mobile IV therapy and teach you all the tips and tricks that I know and wish I would have known in the beginning startup process.